Back in the early 50s, they had a hospital foundation drive in Indianapolis, and their goal was to collect $20 million.
That's a bigger job than I've ever had, to say, yeah, we can do this. Come on, lock arms. We'll raise money. We'll knock on doors. We're going to do this. We're going to build our hospital.
And it's interesting, the hospital room rate, and you have difficulty believing this, was $22.50 a day.
They just wanted to care for patients. And they built their first facility, and Mr. McClin, who was the first president, taught everyone that it was all about caring for people.
And a lot of businesses have left the East Side. And I know there's been a lot of people waiting for me personally to make that decision as well to exit the East Side. And I've said since I was given the responsibility to take over, I would never do that. I would not turn our back on the community that we serve. So we've come up with a very innovative way to build a new hospital while we take the old hospital down.
After Alan Hicks took over, I think his most important contribution was realizing that because Indianapolis is a quadrant city, we needed to be at least on the north side.
When he convinced people to buy 106 acres out here on the north side of the town, which was Shadeland Avenue with Boonville then, that was so far-sighted, and it wasn't very popular at the time.
It's just amazing. This was started out sort of a little more than a first aid station, really, for the people that live north, so they didn't have to come down to the emergency room at community.
Over the past 60 years, Community Health Network has grown to include more than 200 sites of care and more than 14,000 team members, all connected to one mission. Deeply committed to the communities we serve, we enhance health and well-being.
We are only as strong as our network is strong, and we want to do everything that we can here locally to provide the best care to the patients and to the community that we serve.